A thyroid scan is a diagnostic imaging test used to evaluate the structure and function of the thyroid gland. It helps in detecting various thyroid conditions and provides valuable information to guide further management and treatment. Here are some common indications for a thyroid scan. 1. Thyroid nodules. To evaluate the nature of thyroid nodules and determine if they are benign or malignant. 2. Goiter. To assess the size and characteristics of a goiter, enlarged thyroid gland. 3. Hyperthyroidism. To determine the cause of an overactive thyroid gland, which results in excess thyroid hormone production. 4. Hypothyroidism. To assess the thyroid gland's function in cases of an underactive thyroid gland. 5. Thyroiditis. To evaluate inflammation of the thyroid gland. 6. Thyroid cancer. To assess the extent of thyroid cancer and identify any potential spread of the disease.